I have high potassium in my blood. I know it can cause sudden death. What am I to do, doctor? Please help me. Through desperation, many of my senior viewers have asked for my comments on this issue. Normally, your blood potassium level is 3.6 to 5.2 millimoles per liter. In milligrams, your requirements per day is 2,600 to 3,400 milligrams of potassium, which comes mainly from your diet. Potassium is an electrolyte and mineral that circulates throughout your body, maintaining the overall balance of fluids in your bloodstream and cells, and helps with the electrical conduction required for muscle contractions, including heart muscle contraction. Major electrolytes in the body include sodium, calcium, and potassium. A low and high potassium levels are life-threatening. When the potassium level goes down below 2.5 millimoles per liter, can be life-threatening. When the level goes up between 5 to 5.5 milliequivalents per liter, referred to as hyperkalemia, is also life-threatening, and it is recorded that about 2% of hyperkalemia cases end in death. It is your kidneys that maintains a normal level of blood potassium after eating potassium-rich foods. Potassium is freely filtered through the glomerulus and actively reabsorbed in the proximal tubules. If your kidneys are not working well due to chronic kidney disease, so common in not well-controlled diabetes, there will be a buildup of potassium in your blood. How can you find whether your kidneys are working well? The basic tests you do on a blood sample and urine examination to check on your kidney functions include blood creatinine level and estimated glomerular filtration or EGFR. EGFR rate is the best test to measure your level of kidney function and determine your stage of kidney disease. This may vary according to your age, body size, and gender. A normal EGFR for adults is greater than 90 milliliters per minute, according to the National Kidney Foundation. With age and chronic kidney disease, the EGFR drops. People before the age of 70 years over 60 milliliters is accepted as having normal functioning kidneys. In any chronic disease situation, EGFR will start dropping yearly, and when it gets reduced to less than 15 milliliters, may need dialysis. So remember, the commonest cause of hyperkalemia or excess potassium in your blood is due to the kidney disease and failure. You should be under the care of a nephrologist for remedial measures to reduce the blood potassium level by improving kidney function. When the EGFR drops to 20 to 30, there will be symptoms of kidney disease, which include swelling in the ankles and legs, foamy or blood in your urine, fatigue, poor appetite, and so on. With high blood potassium levels, if you find early swelling around ankles and legs, you need to see your nephrologist without delay. You may be on metformin to control your blood sugar in diabetes. When your EGFR drops to 60 milliliters, you need to stop taking metformin, and your doctor will put you on a different medication to control your diabetes. Remember, too much drinking water can affect your EGFR if you have chronic kidney disease. Avoid processed foods and choose fresh fruits and vegetables having low potassium levels. Limit your salt intake to less than 2000 milligrams per day. There are certain healthy foods to bring down the blood potassium levels and improve kidney functions. Red bell peppers are good for you. Half a cup serving has only 1 milligram of sodium and 88 milligrams of potassium. Cabbage has low potassium. Half cup serving green cabbage has 6 milligrams of sodium and 60 milligrams of potassium. Cauliflower, garlic, and onions have low potassium and are good for you. A plain coffee is an acceptable beverage for kidney disease and controllable blood potassium. Additives to coffee, such as milk and many creams, can increase the potassium in your coffee. We always recommend unprocessed brown or red rice for better health, especially for diabetes. The only exception of recommending polished white rice is when you have high potassium in your blood. The reason being the unpolished rice has much higher content of potassium than the polished varieties. Potassium is abundant mineral in the intracellular fluid, as that is fluid within the body cells. It is a mineral that your body requires to function properly, mainly help your nerves to function and muscles to contract. It keeps the heart muscles pump at a regular beat. It also helps to move nutrients into cells and waste products out of the cells. A diet rich in potassium helps to offset some sodium's harmful effect on your blood pressure. Most of the potassium comes from your food you eat. Sources of potassium in the diet is important to know in both low potassium and high potassium situations in your body to control your level in your blood. Remember the leafy veggies you eat such as spinach and collards have a lot of potassium. Dried fruits, cereals, beans, milk, and most vegetables have high potassium. Grapes and blackberries have a lot of potassium, so those who have high blood potassium levels may have to avoid wines and highly pressed blackberries for its nutrients. Root veggies like carrots and potassium have high potassium levels. Juices from fruits have high potassium levels, includes orange juice, tomato juice, prune juice, apricot juice, grapefruit juice. If your blood potassium level is on the lower side, the following foods are beneficial: bananas, oranges, cantaloupes, honeydew, apricots, grapefruits. Some dried fruits such as prunes, raisins, and dates are also high in potassium. Cooked spinach, cooked broccoli, potatoes, sweet potatoes, mushrooms, peas, cucumbers, zucchini, pumpkins, leafy greens, legumes like lentils. High levels of potassium are found in dairy, meat, fish, and chicken. If your potassium level in your blood is on the high side, we call it hyperkalemia. You should minimize eating foods mentioned above that builds up in your body. You may need to restrict your potassium intake to 2000 milligrams per day. Potassium is most used for treating and preventing low potassium levels, treating high blood pressure, and preventing stroke. The more potassium you eat, the more sodium you lose through urine, provided your kidney functions well. Potassium helps to lower blood pressure, and potassium chloride supplementation lowers blood pressure too. Certain medications raise potassium levels, and if your potassium level is high, your doctor will avoid prescribing them to you. Such medications include angiotensin receptor blockers, or called ARBs, and ACE inhibitors. ARBs and ACE inhibitors are used to treat high blood pressure and can cause your kidneys to retain potassium instead of letting it flow out with your urine. A spironolactone, non-steroid anti-inflammatory drugs, NSAIDs, cyclosporin, heparin, propranolol all lead to high potassium levels. In hypokalemia, the level of potassium in blood is too low. There are many causes for low potassium. This may result from excessive vomiting, diarrhea, adrenal gland disorders, or use of diuretics. Certain drugs like diuretics used as medication for high blood pressure can lower your potassium levels. If you take Lasix long term, you need to take potassium tablets, and the common one is called Slow-K. Albuterol used in asthma inhalers can lower your potassium level. Albuterol stimulates your body to release more insulin, which takes potassium out of your bloodstream and puts it into your cells, essentially lowering the amount of potassium circulating in your bloodstream. Insulin drugs at high doses can lower potassium levels and shift the potassium from bloodstream into your cells. Sudafed or pseudoephedrine, available over the counter as a decongestant, can push potassium out of your bloodstream into your cells. Low potassium makes your muscles feel weak, cramps, and twitching of muscles, and become paralyzed. Abnormal heart rhythms may develop. The bottom line is, as mentioned earlier, increased potassium in your blood, called hyperkalemia, can become a life-threatening electrolyte abnormality caused due to medication use, kidney dysfunction, among others. FDA has recommended therapies for the management of increased blood potassium with drugs like sodium pylostyrene sulfonate in clinical emergencies. Other treatment options for hyperkalemia include intravenous calcium, insulin, sodium bicarbonate, albuterol, and diuretics. A new drug called patiromer was recently approved for the treatment of hyperkalemia, and additional agents are also in development. Hope this video talk was useful. Take care and goodbye for now.